Okay, so we'll call the meeting to order, and due to the ongoing COVID-19 pandemic, in accordance with Chapter 20 of the Acts of 2021, suspending certain provisions of the open meeting law, public bodies otherwise governed by the open meeting law are temporarily relieved of the requirement that meetings be held in public places, open and physically accessible to the public, so long as measures can be taken to ensure public access to the body's deliberations through adequate alternative means. This meeting will be live on Zoom. The public may participate remotely by joining Zoom meeting ID number 880-9915-1478 or by calling 301-715-8592. For additional information about remote participation, please contact Heather Hampson, Administrative Coordinator at hhampson@ayer.mass.us or 978-772-8220. Extension 145 prior to the meeting. So with that, the first item on the agenda we have is an executive session. And is there a motion to go into executive session?
I'll make a motion for us to go into executive session.
I will second the motion. Before we go any further, I'd just like to say I was advised that our third member would not be able to make the meeting tonight. I think there may be some personal issues or health issues, but she did call and felt bad that she couldn't make the meeting. So Pam will not be here. Trish, do you want to read the executive session?
Sure. Executive session pursuant to Mass General Law C 30A, Section 21A, exemption number 3, to discuss litigation strategy with respect to the case of Mimi's Place LLC versus Board of Health of the Town of Ayer et al., Middlesex Superior Court, CA 2181CV 4967. If discussing the matter in open session will have a detrimental effect on the town's litigating position, and the chair so declares.
The chair does so declare. Motion's been made and seconded. All those in favor, Ms. Peters?
Aye.
Mr. Slarski? Aye. Board of Health meeting. The Board of Health meeting of January 10th, 2022 for the town of Ayer is back in open session. Is there any public that wishes to be heard? Hearing none, we'll go through the agenda. And any items on the agenda, if it's okay with you, Trish, that were something that Pam was working on, I think we should hold off until the next meeting.
Right.
Okay.
Yeah.
So the next item on the agenda would have been the solid waste trash haulers regulation. So we'll delay the conversation until the next meeting on that.
Yep.
Okay. And next is Ms. Bridget.
So I sent you the stuff that was in the packet today.
Yep.
So there was just some food inspections, just late permits issued. And there was a housing letter in there, trying to think of the address.
Central Avenue.
Yeah.
Yep. So we're still waiting for them to clear out a couple of items of furniture. But I think that was pretty much it, unless you have questions on.
The sink situation at that restaurant, was that resolved?
He is in the process of trying to resolve it. He did contact a plumber. They are working to get him a quote, and he will get back to me. He's just having, I think, a problem securing someone right now. But he has called a couple times to keep me updated. I guess there was one plumber that increased the price a couple of $1,000s. So he
Wow.
is getting another quote.
Okay. I went through the packet that you sent, Bridget. I didn't really have any questions about it. It's pretty self-explanatory.
Yeah.
Yeah,
Did
and
you have
McDonald's just opened back up. I think that was something too that.
Are they open now?
Yeah.
Yeah.
Oh, great.
I have a question about McDonald's. I'm going by there and I see, please tell me they're not putting that play place back in there.
I don't think that they are.
It looks like it because it's got the 2 levels. I'm like, no.
I don't think that they are. I think that's gonna be seating, if I understood that correctly.
Okay, good.
Yeah, I saw the inspection report, but I didn't know that they had opened. So that's good news.
Yeah,
They are back in business.
Great. Anything else for Nishoba regarding update or questions? Is there anything, Trish, you want to mention about the quarterly meeting that I appreciate you attending for the first hour?
not really. Like I said, that was my first time really attending one of those, and it was, I had asked you, Steve, about those, a couple of the towns that were represented there had talked about, there were questions about the town purchasing their own COVID tests through ARPA funds. And I did not ask, I should have asked the question what those funds were and how people access them. I didn't know if maybe Bridget or Heather would know what that meant.
So, sometimes, what some towns are doing are going through the selectmen and getting the ARPA funds, which were through the state.
Mm-hmm.
I think it's part of the COVID relief stuff.
Yeah.
So you would go through the selectmen to access some of that money to purchase COVID tests, but you
Mhm.
have to come up with a plan of how you're going to distribute them, where you're going to store them, who gets them. So some towns are looking at that, and some are just saying that logistically it's not, by the time they get them, the kits might be available again more
Okay.
readily.
Yeah, that was what I was wondering too, because being a school employee in another town, we just went through that whole waiting around to get test kits to go back to school and getting the masks, and logistically, you're right, things like that take time. So that was just my question. I just wondered if that
Yeah.
was something that other
Nope.
people, other towns have looked into.
A lot of people have asked that, but again, the procedure is it goes through the selectmen, and then you sort of have to come up with a plan, because when you get them, where are you going to store them?
Yeah,
Who's going to distribute them? How are you going to do it? How many per family? Would it be through a voter registration list, street listing? I mean, it can get pretty crazy. And
Yeah.
like I said, the logistics of it can be somewhat crazy.
daunting. Yes, okay. All right, thanks.
I think there's some question what the effectiveness is of the home testing as well as it relates to the current variant. I'm not a infectious disease person, but some of the stuff that I've read doesn't look like it is real reliable unless you have symptoms of COVID. So,
Right.
Right. And I think what's happening too is people will find out that they came in contact with somebody the day before, and they get nervous and they take the test right away. But like you said, if you don't have symptoms or it's too soon, it's not going to show up on the test. So I think there's that whole issue too. Jenna from my office, we had talked a little bit, and I think she was going to try and put something together just about how to use those kits effectively.
Yeah.
So.
okay. Trish, did you have anything else for Bridget regarding the Neshoba?
Not really, because I stayed on till 9, and then the vote was the I wrote it down here. The option, can't find it. The first option where it would be Ayer 2020, 2010. I don't have that number as I was scribbling these things down, but we did vote for the first option. Oh, it was 18, we're at 18%, which is $38,579 for Ayer. But I was not 100% clear on what those numbers meant as far as that's what each town is charged, because some of the towns were higher or lower. Like Littleton, for instance, they're opting out. They're not going to be part of it as
Right.
of, I think, June. Theirs was a lot higher because of their population.
which I think, Trish, some of the numbers changed dramatically because the census in the town changed dramatically.
Right,
Ayers went up. And I know that the budget was based on the 2020 census numbers. So I took the information that came from that meeting after you and I attended. I only attended for about an hour. Trish attended for longer. But I
didn't get
sent-
much.
Yeah, we won't go into the details of,
Yeah.
of the comments, but I did send those to Robert
Okay.
to be included in the budget for the 2023 fiscal year. I haven't
Okay.
heard back to him, but I went through the details of what the discussion was for budget option number 1.
Right,
And the way that it was derived at, it's a consensus of the majority of towns that are part of Neshoba. And I want to say it was a 6-3 vote or something, 6-4 vote in terms of the towns approving that option.
that option, yeah. No, 5 yeses and 3 nos.
5 and 3, yeah,
That's what I had gotten, and we voted in the yes,
right.
so.
So that will go into the budget deliberations for the town. And again, it's been submitted to the town manager, so he has the numbers for the budget.
Okay.
And while we're on budget, did you get a copy of the budget that I submitted for the Board of Health?
I did,
Did you get a copy of it?
yeah, the last one, I could not open that, but I did see it. I
Okay.
had it in the email.
I'm thinking, Trish, if you're comfortable, we went over the numbers just to make a motion that we accept the budget as for that we're requesting, know that we've reviewed and accept the budget as submitted for fiscal year 2023 by the Air Board of Health.
Okay, I will make a motion that we accept the budget that's submitted for fiscal year 2023
Okay, by the Air Board of Health.
by the Air Board of Health.
Okay, I'll second that motion. The only discussion is, I believe that there's a meeting with the Finance Committee and all the boards or the chairs of the boards on January 26th. It's the initial review of the budget.
Okay.
And I believe it's a Zoom meeting too, Trish. It's not going to be in person.
So we have to attend that?
I think it'd be a good idea. I don't have the details on time or the Zoom.
We'll probably get a notice or a link, an email, I'm sure. Okay,
So we'll see how that works out.
Okay.
Regarding discussion regarding COVID-19, Bridget, is there anything you want to talk about regarding COVID-19?
Oh, Steve, real quick, before you move on, you made a
Heather.
motion, but no one
Oh,
voted.
yeah.
Oh.
Oh, you're right. Heather, thank you so much.
Oh, you're very
Motion.
welcome.
Motion's made and seconded. All those in favor? Ms.
Aye.
Peters? Mr.
Aye.
Solowski?
Yes.
Aye. Okay, thank you.
thanks, Heather. Okay,
Do you want to talk about COVID?
Not really.
No one does.
come on.
And I'm thinking the less we talk about it in the future, the better off we probably are. But I think that things are going to change in terms of how we respond to it as boards of health and what the policy will be across the
Yeah.
country.
I agree. And I think that we're just going to have to get used to the fact that it's going to be here. It's probably going to be part of our lives, just like the flu. And, right now it's just trying to get through all of these cases that are coming in. We were averaging last year, when we thought it was the peak, probably at some points around 40 cases a day. We are at 375 now.
Crazy.
It's just, I don't know. I mean, I don't know what to say other than it's really impacting businesses because of staffing issues again. So just, be careful, wear a mask, wash your hands, be cognizant of where you're going and who you're around. I don't really know. I mean, it's all the same things that we've said, but to go from, 30 or 40 cases a day to 375, the nurses are just, it's a constant battle. And, I do want to say we're seeing different levels of sickness with no rhyme or reason. Again, some people are very healthy and very, very sick. Other people, they're just battling through it okay and mild symptoms. I think a lot of the cases where they have severe illness right now are unvaccinated. But again, levels of sickness, that varies, for no rhyme or reason in some instances. So.
Bridget, do you think it's fair to say, though, that people should do the same thing? If they feel sick, stay home, don't come out.
Exactly.
And if you have to go out and you think you have a cold, wear a mask. It's not about you, it's about making sure you don't get someone else sick. I mean, I think that that's as simple as the whole thing is.
I mean, and that's a very good and very important point, because, again, we have seen how fast it does spread, and, it can impact everybody differently, and you can inadvertently really make somebody else sick by being out there. And there are people out there sick. They say that they feel okay, it's just a cold, so they're going to go out. There are businesses that are telling their staff to come into work sick, and we're trying to battle through that and really educate people that it's not worth it, because in the end, you can make somebody really sick or even die.
Yeah.
Everyone has to work together and just be diligent, be cognizant of the signs and symptoms. If you're not feeling good, stay home. That's it. And you're right. And wash your hands, which you should be doing anyway.
Yep.
Right.
So Bridget, I want to say thanks for those signs that Nishoba put up that they brought around. I noticed a lot of the businesses in there have them, requesting people, if they're going to be indoors, to wear a mask. And I just think it's a really great practice. So you said someone from your staff helped put them out as well?
Yes, Mike Martian, he's new in our office, and he's been delivering the signs to some of the establishments downtown. So
any chance you can send us a list of who was given signs?
yes, it's going to be from my we didn't write anything down. We just sort of went down through Main Street. But I can put a list together.
If you could put a list together, that'd be really good. And then maybe it's a list that we could post on the Board of Health website, just reinforcing the request to wear a mask.
Yeah, and what we really tried to do is target the businesses that were more the high end, bigger volumes of people at one time.
Yep.
Now that I'm sitting here, I just thought of a few that we didn't go to, so we can do that again tomorrow. But we did try to target the gym on Central Ave, did post
The
a
gym has a
sign.
sign right in the front door. I'm there every other morning and it's clearly visible.
Yep, and I do want to say some people actually also posted them on the inside. So right when you walk in, it's actually on a wall.
Yep.
So just keep that in mind. It might not be on a door, but we'll put that list together. And then if there's anywhere else that you feel like you want us to go, just let us know. But I also just, if we have a second, we have, from doing inspections at the food establishments and delivering the signs, people were, for the most part, grateful, because they're trying to protect their staff.
Yep.
And by people wearing masks and everybody working together, it really helps them out. And it makes them feel more comfortable, and it makes them feel safer. I mean, they're going to work, you just don't know. People are just, it seems like everybody has it. So there's that mask offers a level of protection for them. So people, for the most part, like I said, we're actually very grateful.
That's good to hear. So Trish, when we get the list of places that posted the signs, we can talk about it again, but I'd like to post it on the Board of Health website so people will know. Does that sound reasonable?
Does. it does.
So I'm gonna tell you where we dropped them off. We can't say for sure if they put them all up.
No, after you tell me where they were dropped off, I'll take a ride around to see if they're up.
Okay,
And we'll put a list together, and then I don't see a reason why we wouldn't post it where, the signs have been posted, so.
Mhm.
Okay. Sounds good. Again, Bridget, thanks so much for your help with that.
Yeah.
yeah,
thank
no
you.
problem.
Trish, anything else from the Neshoba?
No, not really.
Thank you for going to that meeting, guys.
I talked to Bridget about it today. If I embarrassed the town of Ayer, I apologize, but.
You did not.
Um, So moving along, the minutes from December the 13th, I think we should hold off until Pam is available to go over them. If she
Okay.
can't do it the next meeting for whatever reason, we
All
can
right.
take it up then. But are you okay with that?
Yes.
Okay,
Yeah,
we'll hold
that's
off on the minutes. Do we have any bills or any mail, Heather?
No.
Okay, are there any action items that we're missing right now that you're aware of?
Nope.
You have anything, Trish?
No, I'm trying to think of the next time that we had Lori Nearing and Laurel, but that's a ways out for them
Okay.
to come back and speak about the PFAS.
The budget we already talked about.
Yeah.
Bridget, is there any statistics that we keep? And Heather, I've got to do a paragraph for the town report. And I've got until I think February to submit it. But if we had any statistics in terms of how many licenses or how many inspections, anything that would be relevant, if you guys could send me a copy of that, that would be really helpful.
So yeah, Steve, I can send you how many chicken permits and tobacco and trash haulers were done for 2021.
Okay,
What we just signed and issued, I got to double check on that. And I know Neshoba does its own part of the town report. So everything that Bridget does for inspections and food services, they'll draft their own, and that goes in the report along with that. So it's basically all you're doing is what the town itself has done,
okay.
which is just that, which, I mean, we obviously got to include something for COVID because
Oh,
I mean, I'm sure you can
absolutely.
see the call log that has,
Yep.
those calls have increased quite a bit over the last few weeks.
Yep.
To even getting a phone call from someone from Shirley yelling at me, leaving a message on Friday, because apparently Shirley has a mask mandate and there's no one to enforce it. So I get a phone call yelling about it.
What?
So that was
Really?
fun.
No, I think when we talked about that, I thought, Bridget had the right idea, is that we can request, but if people aren't going to do it, they're not going to do it regardless. And, we're not the mask cops, and neither is Neshoba. So hopefully people would just act in a responsible way.
Right. All you can do.
So yeah, if you can give me the statistics, and I guess if there's anything, Bridget, that you have, even though you do your own part of it, I'd like to take a look at it, if or I actually like to see what Neshoba is going to say, so that we're talking the same language. That would be good.
Do you have a copy of last year's to compare it to, Steve? Yours would-
I can get one, Trish.
Yeah.
I do have a copy of the 2020 town report. I don't think I have 2021.
Well, you're doing 2021.
I thought it was 2022.
It's 2022 right now, but the report you're writing is for 2021.
Oh, so I wasn't
Yeah,
here.
so
wasn't here
you're
for
doing
it.
the 2021 town report. We're doing fiscal year 2023. Towns are
Okay.
very weird
Gotcha.
as far
Gotcha.
as
No,
what years you're in. You got to try to keep them straight.
Gotcha.
So
Okay.
then that would have been Pam. No?
Yeah, well, it'd be Pam. Yeah, I'll talk to Pam.
Yes.
I'll talk to her. I can put something together. We can do it together, whatever, but that's
I
good.
had thought at one time, I remember her talking about, unless it was a year before that, that she was putting something together, and I thought she already had something written, but I'm not 100% sure.
Good point, Trish. I'll check with her and see.
Okay.
I feel comfortable writing something about COVID for the town, or maybe Pam wants to, but I'd be happy to do that too.
Oh, okay, good.
Licenses not renewed update. The license that I was going to mention that hadn't been renewed, I was told by Bridget today that they received the new license for one of the food establishments today. So there is no issue with that. That's my understanding.
That is correct.
Okay. And the other thing I wanted to mention in terms of license renewals, Bridget had sent me a copy of the renewal for the Ayer Motor Inn on Fitchburg Road. There's no change in ownership. The management's the same. I'll review the application, and if you're okay with that, Trish, we'll renew the application as long as it's complete.
Yeah.
You know, that, like I said, there's no reason for a hearing because there was no change in ownership. Okay.
And we did confirm that, right, Heather, through,
Yeah, that was the ad. I gave you the name that was
Yep.
listed in the assessor's records, and
okay, that's what I thought. I just was double checking my my notes, but yeah.
Yeah.
Okay,
Okay. And Heather, when you put the
Yes.
minutes together, if you just be clear that we discussed this
yes,
and no hearing was required because there was no change in ownership.
yep.
and it was
I will do
under,
that. And Steve, I didn't know when you put that on the agenda, I didn't know if you wanted me to check. So I went through real quick and did the tobacco permits.
Yep.
So just so you guys know, all the tobacco permits that from last year have been issued for this year. I'm only missing one. And 2 businesses have closed. So I just noticed that. So I'm doing that. And then as far as the trash haulers go, I've received all but 4. So I'll resend the letters hopefully tomorrow to get those last 4 in.
Okay. So mentioning the trash haulers, can we just go back to or talk about one additional item regarding trash haulers? You
Yeah.
okay with that?
Yeah.
Do we have a master list with their emails of the trash haulers for the town, Heather?
I don't believe I get their emails. I'd have to double check and see what I have on the applications. But there is a trash haulers list from 2021 for the last one that's on the town's website. Since we don't have curbside pickup, everyone that gets a permit gets put on a list, and that gets posted to the town's website on the Board of Health page.
Okay. The reason I was saying if we have the capability of sending them an email, I know it snowed and I know that there's bins out on sidewalks, but is there any way of sending an email out just reminding the haulers not to drop the empty bins back in the middle of the sidewalk? Because they clearly were in the middle of the sidewalks today. And I was watching one of the trash haulers. There's no reason why they couldn't put the bin off to the side of the sidewalk.
I will see what I can do and what I have for emails. But I
Okay.
can't guarantee that I have a bunch of them, but I can look and see what I have, and I'll send
Yeah, I was just gonna
a
send out,
blanket
like-
email for what I do have.
Yeah, just include everyone under one email. You okay with that, Trish? Or
Yeah, is this something, not that you've noticed in the past, I'm thinking this routinely must happen when we have snowstorms.
it may, but
Yeah.
there's no reason why the trucks couldn't
Right.
put the empty bin back off, and even in the snow if they have to, but
Yeah.
I don't think it needs to be blocking the sidewalk.
Mhm. Okay,
And I'd rather do it just as a friendly reminder to the trash haulers, that's all.
yeah. Makes sense.
Okay. So anything else, Trish,
No,
Heather,
I think
No.
we're good.
Bridget?
I'm good.
Okay, well, with that in mind, if everyone's good, do we want to adjourn?
I'll make a motion to adjourn the Board of Health meeting for January 10th, 2022.
I'll second the motion. And this time we'll take a vote. All those in favor? Trish?
Aye. Aye.
Steve Slarski, aye. Thank you, everyone, for your participation and your hard work.